for primary care. So that just means we look after some of the digital projects and the nursing teams, and particularly help support GP practices with the uptake and adoption of digital tech that might help our patients with long-term conditions to better self-manage their care. Today, we're particularly talking about my diabetes. So I've been working on my COPD and my asthma. I've had my diabetes floating around for a little while, but we're now in a position to be able to roll it out at a greater sort of level. I'm going to share my screen, and hopefully this will work. And I guess we need it. Okay, I can't see you now, but can you see my screen?
Yes.
Yep, we can.
Yeah, lovely. Okay. So digitally enabled care. So today we're talking about diabetes in particular and how we can use My Diabetes, which is an app we've commissioned in NHS Dorset to help these patients better manage their condition. And this is part of the My Health suite of apps. So if you've come along to the Huddles before, or you're a digital care coordinator or nurse, you know that we've been working on My COPD and My Asthma in Dorset. Okay. So digital huddle today. So what we're going to talk about, so if I can move my screen along, let's just see if that works. Okay, there you go. So the huddle, the purpose of the huddle is really just to support you guys in general practice and elsewhere, and gives you the opportunity to ask any questions, share your experiences, and to learn a little bit about the work that we're doing and supporting you to do in primary care. So we're focusing on My Diabetes today. We're going to have a little look at what it offers our patients that are living with diabetes, the risk stratification, so those patients that we think would be particularly a benefit to have this app as part of their care, how we increase the uptake and adoption of these tools, and then some of the resources and training that are available. Feel free to interrupt me and ask questions. I can't see you, so if anyone's got their hand up, perhaps Carly, you can let me know. And then just what's the future of our long-term condition huddles moving forward. Okay. So the appetite for digital, why are we doing this? So we know our long-term conditions account for a significant proportion of appointments in general practice and bed days spent in the hospital beds, making up 70% of hospital and primary care budgets in England. Type 2 diabetes, we know particularly post-COVID that numbers are rapidly increasing. Patients in the UK living with type 2 diabetes and affecting perhaps 3 million people in the UK today. Structured education is a large part of managing type 2 diabetes, promoting a healthy lifestyle, helping patients to improve their blood sugar control, and preventing the complications of diabetes, which we know are cardiovascular disease, particularly heart attacks, strokes, kidney disease, and retinopathy of the eyes. Uptake for education courses has been variable. By offering an adjunct to a class-based education as a digital option, we might be able to catch some of the patients that are unwilling to attend structured education, or those that for whatever reason they've not been able to attend, but they will be able to access some structured education about their condition. Sorry about my grammar mistake on that screen. Okay. So what is My Diabetes? So it's an app. It's an app that patients can use on their phone. It's an app that patients can use on a tablet, or actually on a laptop as well. It's a Kismet approved app. That means it's been through a process where they've looked at the education that it provides for patients with both type 1 and type 2 diabetes, and it meets the standard of structured education. The app will self-populate the information given to the patient depending on whether they've got type 1 or type 2 diabetes. And I know there's other types of diabetes, but at the moment we're focusing on type 1 or type 2 diabetes. So the information that's in the app that the patient will be able to access, particularly in the education sections and the treatment sections, if a patient has got type 2 diabetes, they won't be bombarded with information that's really relevant for a patient with type 1. My Diabetes is the most comprehensive, user-friendly diabetes app that we've got on the market at the moment. It's built by diabetes experts. It's been peer-reviewed by Orca. It's in our app library. And the idea is that we give the control back to the patient and help patients to self-manage their condition a little bit better. It contains expert education on all aspects of diabetes, and as we go through the presentation, you'll see some of the features of the app with the overall aim of preventing those long-term conditions that we know these patients are susceptible to. So it's changing the way patients engage with us. We know that we call them for their annual reviews in the same way. Often patients don't quite understand why they're dropping their urine off for us. Hopefully they do a little bit more with the ACR project, and we've got Siobhan on the call today as well. The reason for their yearly eye check, why we're doing that, what's the importance of checking their feet, and how that they can help with some of these care processes themselves as well. So can be held on a tablet, can be held on a mobile phone. It can be downloaded from the App Store or the Google Play Store for those that are on Android. Okay, so this is just a snapshot of the dashboard that the patients will see. So the tiles mean different things. The green tiles are to use most days of the week. The patients will use these sort of much more regularly. And then the blue tiles, they might use every few weeks or months, you know, to put in a blood pressure reading, to look at a blood test, etc. The pink tiles are educational tiles, and there's the one there that says educational education course. That then will lead them to a huge array of different education topics that they can choose. They're all quite small and sort of bite-sized, and patients can move through them at their own pace. The orange tiles are for editing information, either as you as a clinician or digital care coordinator or patient themselves. And the red tiles are sort of action tiles or alerts, which might want to alert the patient to the information a little bit quicker. So the hypo one there. So if patient was to click on the hypo, it would have information on what to do in the result of a low blood pressure. The notifications, bottom left hand side, so we might want to send a patient a notification. Please could you record your blood glucose within the app for the next week prior to our appointment, or if they've got a blood pressure machine, we might want to remind them of a appointment, etc. If the patient also has other long-term conditions such as COPD or heart disease, asthma, they can move through the app without having to log out and log into a different platform. So they can just switch between the apps there if they've already got My COPD or one of the others. Okay. So as we said before, it's for patients suffering from type 1 or type 2 diabetes. It allows blood glucose monitoring. It is Bluetooth enabled, and I don't believe that the Bluetooth monitors are on the formulary just yet, and that's something is on my list to discuss this week. So the Aga Matrix and the Gluco RX, which I know we mostly use in primary care, they both now have a Bluetooth enabled version of those monitors. And if the patients are using those monitors, then they can connect with the app and it will automatically download their glucose monitoring. So the patients don't have to write in, you know, type in their blood glucose monitoring if that's what you've agreed to do with the patient. It's got a medication diary, so they can put their medication in and they can click to say they've taken their medication. There's targets in there, and there's information about what a HbA1c is, their cholesterol and their lipids. Lifestyle, so there's a huge lifestyle section to the app, which is really useful for our patients who want to ask about diet, what portion control. And we get lots of patients who ask us for information about diets. Can you give me a diet sheet? So the lifestyle information is very comprehensive. There's also a 12-week exercise program within the app as well that also looks at diet alongside that exercise program. Blood pressure monitoring, so there is a Bluetooth enabled blood pressure monitor that Omron have made that does connect to the app as well. There's a section on stop smoke, just like the same for COPD and asthma, and there are sections on retinopathy, foot health and kidney health monitoring to tell the patients why it's important that they come for their annual review, why we need to look at their feet. And sometimes I know we've got patients who refuse to take their shoes and socks off, but what the patients can do themselves, what happens if they get a blister or a wound on their foot, what should they do, what action should they take. The comprehensive educational course, as I say, is adapted for the patient to work through it. And if we see that a patient's worked through it and they've not gone to their structured education, obviously that's the way we would prefer the patients to go, and this is an adjunct to that. But if they declined to attend the course and they've worked through the educational course, then we could code that as they've attended structured education. Okay. There's some links within this presentation, so I can send you later. Some of the education topics that are covered within the app. So just, I won't read them all out, but you can see on there that there's lots and lots of different sections. The diet and the carbohydrates is really, really good. And I've had a look at that myself for thinking about, okay, you know, what's a healthy diet and to help with weight loss. Portion control is very important on there. Dieting when you're taking exercise and the effect on blood sugars, that's in there as well. So lots of information there for your patients. And you, if there's one specific area you see your patient, you can say you could look on the app and have a little work through that educational program and tell you more about the query that they've got. How to measure your blood pressure. So that's really important if they're measuring their blood pressure at home, that they're doing it in the correct way. And obviously our patients with diabetes, if they don't have any of the exclusion criteria, they're also eligible for the BP at Home project as well. Kidney health, so we'll talk about why we do an ACR. We ask the patient to bring in their urine sample. We're not testing for infection. We're not necessarily testing for glucose. Why are we asking for that urine and the importance of doing it? And now we've got our ACR digital project, which will complement that as well. If you go to the educational section, so these are some of the little icons that will come up for the patient to choose from, so they can click on any of these, and most of them are, you know, a few pages long. They're not huge long educational sessions that patients need to work through, but they're just nice and concise. Diet, lots about carbohydrates, lots about fats as well, and good fats and the not so good fats and the effect on our cholesterol and our triglycerides. So how we can engage with patients within the app, that red button that said notification. So we can send either a message to all of our patients, perhaps to tell them that flu has arrived and you want them to book in for a flu jab, or you can write a message to an individual patient. You can send them a link. So if there's something specifically you want to send them, a bit like you might use AccuRx for, you can send them a link to look at something specific, or perhaps a patient.co.uk leaflet, for example, or you can send just an individual patient a message and some information. So that's really helpful. At the moment, the patients can't respond back to you, and I know that you've got that option on AccuRx at the moment for the time being. The walking video, so for patients that perhaps aren't so mobile and you want to get them to do a little bit more exercise, then the walking tile's lovely. And if you work through some of these videos, and I've played most of them, they're lovely scenic routes around Dorset. So Highcliffe Castle's on there, Hengistbury Head's on there. I've spotted Upton Country Park on there. So if you've got a patient who says, I can't exercise because of my joints, my knees, my mobility, they could do some form of exercise at home, and doing it with a nice scenic route that's moving along with some nice weather and the seaside and the waves is a little bit more interesting than just a patient exercising on their own at home. So the walking videos range from sort of 5 minutes to 50 minutes. Patients can build up, you know, do 10 minutes this week, increase to perhaps 15 minutes the next week, and so on. But it gets the patient moving. But if you've got a tablet or a laptop or computer at home, it's much nicer on a big screen to see something really nice moving alongside with you than just the four walls of your room, perhaps. There's a diabetes checklist within the app, and obviously we can add to this and the patient can add to it, and it will notify the patients of things that aren't at their target, and targets are all individualized. But if there's something that we're particularly working on with a patient, then we can pop it in there, and the patient will know if there's something that they haven't achieved or something that they're working towards. We talked about risk stratification, and if you remember, we did this for COPD and asthma. These are patients that we're actively trying to target. So it doesn't mean that if you've got a patient that you feel that would really benefit from my diabetes, you can't add them, because you can. You could offer that app to them. But these are the patients, using a population health management approach, we say these are the patients that we need to try to target. So they're ones that don't have such good control of their diabetes, and they're ones that require education in particular. And then the group three there is those that are at risk of disease progression. And this might be because of some sort of inequalities, the characteristics of where they live, or themselves. For instance, we know that patients that have got depression or mental illness may not have the ability to really focus on their diabetes and might need some additional support there. Exclusion criteria. So if you can't consent, obviously it might not really at all for you, not for those under 18 years of age, and not for those in a care home at the moment. It doesn't exclude those that are digitally enabled, because if patients want to do digital technology, then we would like them to receive the support to be able to for them to do that. And we've got the digital champions and the embedded digital champions, or the champions that are in the libraries, and the Dorset hotline for the champions. So if patients are struggling with some of the digital technology, but they'd really like to take part, then enabling them to do so is really empowering for the patient. So this risk stratification we made with the diabetes leads within Dorset, and said that these are the patients that our digital care coordinators will look at the dice, and they'll try to sort of find these patients. So the DICE, I think most of you know now, but the Dorset Intelligence and Insight Service, it looks at all the health and social care data in Dorset. And we can look at patients and say, these are the ones we're really going to try and target. And you can see the risk groups there across the top. And if you've got a care coordinator or digital care coordinator, we can send a SMS message to the patient offering them to onboard to the app, which saves clinical time, but clinicians may also identify patients in their annual reviews or 6 monthly reviews, etc. If you've not used the dice before, then do let us know and we can help you gain access to the dice. And there are some tutorials online as well to tell you how to navigate it. But where we've got primary care network at the top, and you drop down the little drop down there, you can choose your own PCN, and then you can filter it to surgery level, and you can say, okay, I'm going to look at all those patients who haven't had structured education and they've been diagnosed within the last 12 months. And those patients, you can say, right, we're going to do something with these patients. We can identify using the green button down the bottom. If you're authorized to do so, it will give you a list of those patients' NHS numbers, and then you can contact those patients yourselves. So the next screen here, this is just taken from the dice. This will just be able to show us which patients then do take up the app, and what do they find useful within the app. So over here you can see we've targeted patients where we've got no health education, no diabetes health education recorded. If it says there's too many patients, it might ask you to just filter it down into a bit of a smaller bite-size amount. This says South Coast Medical Group because that's where I work in my clinical days. I had a little look at this last night. We've got about 12 patients or so over at South Coast Medical Group who for one reason or another haven't attended education. And I know there's been a big change with the new to type 2 education with the virtual sessions. Okay. When you want to re-identify those patients, so the digital care coordinators can request that data. So all the data is anonymized. When we request it, then you'll get a CSV file with that patient data that then you can do something with. So it'll give you the NHS numbers of those patients. Okay, so that was me, just my dozen patients last night, looking to see who they were. Okay, if you're new to MyM Health, please don't worry, we're here to support you. Most of our PCNs now are using it to some degree, perhaps just for respiratory at the moment. The email address for operations is here, and they will ask you to fill out an app setup form. So we want just one account per PCN, and then different staff members. It might be a social prescriber, it might be a pharmacist, it might be a nurse, it might be a HCA, digital care coordinator that will have access to onboard a patient onto the app. So if you're new to Mime Health, please do let me know and I can help you set up the account for your PCN. But I think most of the PCNs now are up and running. Once you get access, you'll get a login to your email address and you'll set up a password. And when you log in, you'll see this screen here. So this is my screen for South Coast Medical Group. And this just shows how many patients with COPD, asthma and my diabetes that we currently have using the app. So you see I've got 65 patients over at South Coast Medical Group, not just myself, but the other nurses across the PCN that have been adding the patients and even the social prescribers and digital care coordinators. But if you want to add a new patient, if you log on, and staff have asked me just to show this today, where we've got add patient here, if you click add patient, it will take you to this next screen. How will the patient's data and symptoms be recorded? So we want to click this one here, self-managed by the patient. So this is self-monitoring by the patient. As much as we can go in and see the data that we've done, it's not remote monitoring. The patients are not being monitored by us 24 hours a day. This is self-monitoring by the patient. We'll ask the patient's email address. Mostly we've got that email address as Sister One in the non-clinical details, but just make sure that we have got a correct email address, else it'll bounce back. Once you put the email address in, as long as it matches and it's a valid email address, it will take you to this screen. So you can see I've just put my email address in there just to bring up the rest of the page. You want to pop your date of birth there, patient's date of birth, NHS number, their gender. The rest will self-populate. So as long as you've got that date of birth, NHS number, then the patient's name should automatically self-populate into that screen. Down the bottom, it will say, what apps do you want the patient to use? It might be that they've got COPD and diabetes, and then you can click on both and just tick both boxes. I couldn't get the whole of the screen in there, but you can see for this patient, we could have just clicked my COPD, but my diabetes and asthma are just below that screenshot there. So that's all you need to do to add a patient. I reckon it takes about 30 seconds. Then the patient will get a notification. So this bit's important. So the patient, once we've added them, they'll automatically receive an email from Mime Health. So we want to just let them know that that's going to come to them. It's not spam, and they can trust the links within that email. And there's a blue activate button within the email. And if they click on that, then they can get started and they'll have to add a little bit of information. They'll have to, the first time they log in, they'll have to agree to the terms and conditions of the app. And if they download the Mime Health app, then they'll get the best experience from it. But sometimes for some of our elderly patients, having a tablet or a laptop is better, but other people like it on their phone so that they've got it with them all the time. So we add the patient gets an email, they click on the link, and that's it there, they're off and running. A little bit about coding. So if we code to say that we've registered the patient, it's in the diabetes Ardens template. So that's your diabetes online template. So where you're normally doing your work is here, the assessment and review plan. But after we're working through these, aren't we, when we see patients, and we may use these other ones a little bit as well, remission. The online section of that, so you haven't got to go into another template. You've got My Health there, which will take you to the account. You'll have to log in. But if you could just code the patient there. So the first drop down box is registered for access to patient facing services. So we need this patient to be coded, and that's so that we can see that information back into the DICE, and we know how many patients are using it and do they find it useful, and helps us sort of decide what services our patients need moving forward. So how can we increase uptake and adoption? So at diagnosis, patients new to diabetes, we want to refer them to structured education, but we can offer them My Diabetes as well. The structured education teams for diabetes will be using My Diabetes as an adjunct to their sessions, a bit like pulmonary rehab do as well. During our reviews in our practice, we've got Refocus Eyes pilots currently going at the moment, which is our exercise and diet new version of Refocus that's happening over in the east of Dorset at the moment, and I'm attending their session on the 21st of November. So those patients that come in to the Heart Club for exercise about and education with Sam Whittle, lead DSN for the community, I'll be talking to the patient about the digital options and how that can support them as well. If you're a PCN, you can have promotional videos put onto your TV screens. There's posters, there's onboarding scripts that you can use. So you can advertise it through your normal social media on your websites, etc. We can build a self-referral link for you. So if you want to have a link for patients to click on rather than contact patients, you might want to put that onto your website or onto annual review messages, etc. But it is per PCN, so it's specific to you, and somebody will still need to add the patient. But if the patient clicks on the link, it will take that information to an email address, which generally we've done to the digital care coordinators, and then they've been able to add the patient. So the MJOG campaigns, that's what we're using the dice for, and that risk stratification, sending messages to patient to say your surgery feels that this would be a benefit to you. Do you accept or decline? And then those messages automatically come straight into system one. So that coding is there, but we still need to add the patient. A quick little bit about digital care coordinators. Many of your PCNs have got fabulous digital care coordinators and digital champions. So please, use them, help patients to increase their skills with digital technology and to navigate the world of digital apps, particularly around health. So if you don't have the number, I can send it out for the digital. Actually, it's at the end of the presentation for the digital champions. If you don't have a digital care coordinator, you might have a care coordinator or someone who does a similar role. Just a quick look there that how you may have posters and leaflets that will benefit the patient. So how can you spread the word and how can you get the message out to your patients? So through multiple ways, through your clinicians, but also through other means as well. We've got a test account. So if you go onto the My Health Dorset test account, you'll find it really beneficial to see the patient's journey. So you can go through some of those walking exercises, the 12-week diabetes weight loss program, or some of the educational sessions if you want to see it from the patient's point of view. That's the contact for My Health. That's me. I'm here to support you with your technology, particularly sort of nursing and primary care, and how we embed this a little bit greater into your practice, your daily practice. That email address is wrong on there, so I think you've all got my email address, but I'll send it out afterwards. E-learning, so there's some great e-learning, and you'll get a certificate that you can use for your validation, etc. The e-learning are little sections within the My Health website, which will tell you again how to onboard a patient, how to deal with any accounts issues, and how to send notifications and the benefits of the apps, etc. Resources, that's for your posters and your video displays. Digital literacy support, that's the Dorset digital hotline for the digital champions. And just down at the bottom there, the primary care training hub website has got all the recordings of the digital huddles, and it's got links there to My Health and the disease awareness educational sessions as well. I'm aware of time, so I'm just going to bring you back. Okay, can you see me again? Hi, Louise. So that is a very quick run through, because I know we're very short on time. Enthused you or confused you?
Cheryl, there's one in the chat from Fern saying,
Yeah.
Does it have any casting ability for these videos?
Say that again, sorry, Carly.
She said, does it have any casting ability for these videos?
Any what ability?
Casting of ability. Fern, I don't know if you just want to clarify that one.
See if I can see the chat.
Oh, like Chromecast. So sorry, Fern, do you mean like can patients put it on their TV and stuff like that? Yeah, so I would imagine you could, because it's just within an app. So if your phone has the ability to cast, then you'd be able to cast straight from the app. Can't see that would be a problem.
Glad you were here to answer that question, Carly.
Yeah.
There's always something with digital technology that stumps me. I'm like, oh, I'm going to have to go away and look that up myself.
That's why I waited to ask you, Cheryl, because I read it and went, I'm not sure what she means. It might be a clinical thing.
Yeah, thank you. And anything else? So we're working with diabetes teams. So we are looking at the pathway for diabetes education. Agnes, we've got you on the call today, so nice to see you here as well from Shore Medical. So we want our patients to attend their diabetes education. This isn't to replace it, but we are aware that there are some people that we can't get them there, and this might be an option to them, and also as an adjunct to extra education. Agnes, yeah, you got your hand up.
Yes, hi. Thank you. Thank you for that, Cheryl. Was wondering, obviously, about the time because we are working under massive pressure at the moment. So, have you tried at any PCN to send the invites as a bulk sort of, or do you need obviously do you need patient agreement to be sent that link because it's sort of like self-management link, isn't it? So they could ignore it as well as accept it. So I was just wondering if you tried that anywhere.
Yeah, so with the MJOG, we can obviously send out bulk messaging, but that's where we need your digital care coordinators to access those lists from the DICE. You might decide to have a different view of it, and you might say, well, okay, I'm going to invite all patients with a HbA1c of a certain level, or those that haven't come to education. So the DICE is the risk stratification we've made, but you can invite who you want really to it, and you could do your searches through using the DICE and MJOG, but you might decide to do it in bite-sized amounts, or you might decide to invite everybody. At the moment, we've got enough licenses for those that we envisage that would be using this, but that's always under review. Nicola?
Hello, I've just had a question. So because I've been referring people onto it, and some of the people that I look back onto the dashboard, all of their information's blank. Does that self-populate, or do they have to input it themselves?
So information like what their HbA1c is, Nicola?
Yeah. Is that because they haven't clicked the link yet?
Yeah, no, so that won't automatically populate into there. So that's for either the patient might want to put their HbA1c in there, and you can say to them during their clinical review, this is your HbA1c. Do you remember where we used to have what they call corporation cards? We used to have like little books, and we used to write their HbA1c in it each time they came for their review, tick the box that we'd done their feet. Well, almost like it's a patient held record that they can put that data in themselves, or you can, Nicola, you can add it to their record if the patient wants you to do that, but no, it won't self-populate. Okay. Yeah, so their demographics for the surgery, etc., will, but that data at the moment is not interoperable. Yeah. Has anybody tried it yet? Has anybody got any patients that have worked through it yet? So we know we've got my COPD and my asthma now being extensively used across Dorset, and we're in the process of looking at how we do our asthma reviews using technology. And I know over at Shore Medical, you've been doing something similar over there. So my diabetes, it's how we get the patients to engage in it. And you'll have patients that have perhaps had diabetes for some time who might struggle with control, and it may really help them to readdress that education and that activity in their own time. And we understand you might also have patients that no matter what support you give them, they may still struggle with their diabetes control. So it's individualized on which patients it will be a benefit to. But I do think particularly those that are newly diagnosed, you've got that little sweet spot there to try to get the education and the engagement as best as you can. Or sometimes after an event, if somebody's had an event and they've been in hospital, or they're waiting for surgery, that might be also a time where you might be able to get them to engage. Agnes?
Yes, just a little question, most of pragmatic. The slide 22 was patient activation slide, where is it generic that is asking that question, what is type 1 diabetes? As obviously there are different types of diabetes. I just worry that patients going to worry that, oh, I haven't got type 1 diabetes. Why do I have this link? Or is it just by chance that picture on there?
Yeah. So when the patient, so we register the patient, when the patient puts their data in, it will ask the patient if they've got type 1 or type 2 diabetes. And then all the information self-populates. So if someone's got type 2 diabetes, they won't be bombarded with all the information that perhaps is geared to a type 1 around sort of carb counting or some of the tech that we use for type 1 patients. So that automatically will eliminate any of that data being seen by the patient. And the same for My Heart. We've got patients who use it for heart failure and those that use it that have had perhaps a valve replacement. But in those instances with My Heart, it's us as clinicians which are ticking the box when we register the patient to say which of the heart conditions they have. With diabetes at the moment, it does ask the patient if they've got type 1 or type 2. It's not asking us to put that data in. I'm hoping that most patients understand, but I take your point there, Agnes. I have come across 1 or 2 patients.
I think you would be surprised. Those on insulin, they're convinced they've got type 1 diabetes.
Or I started someone on insulin and they said
which could actually be.
I've got type 1 diabetes now, and I was like, no, you still got type 2, but you're
Yes, and
treated with
obviously
insulin.
you've got a degree of patients with different types, like secondary diabetes or diabetes
Yeah.
3C, so that
Yeah.
may be a bit problematic, but
Yeah, we
there's
know
a
that.
small numbers, yeah.
Yeah, we know that there's those ones that don't fit either box. But if we think at the moment we're coding them or treating them as a type 2, and they can access that information, particularly about those education sessions, that's really good, isn't it? Okay. Any other questions? Or would anybody like me to follow up with them in their surgery and their PCN?
Cheryl, hi, Julie from Crane Valley here. Yeah, it would be good to have a catch up again. I know we spoke sort of early autumn, but it would be good to talk again. I'm trying to pin down our respiratory nurse to have a chat and to sort of look at the systems now that you've kindly got us going in terms of system logins. So yeah, if we could do something, and I think you are only available on a Wednesday generally, aren't you?
Generally Wednesdays. I can be a bit flexible with Fridays, Julie, if you need
Okay.
some support on Fridays. If it's a very specific day, I'm sure we can work something out. But Wednesdays and
Okay.
Fridays, I'm always around if that
Okay.
helps.
Well, I've gone back to Lisa Oakes and suggested some dates. I just need to get some confirmation of that.
Yeah, if I remember right, I think Lisa might not work a Wednesday. So yeah, I can be flexible. That's fine.
Yeah, I know she doesn't work Mondays, but anyway, yeah, so that would be great. Perhaps you could just email me some availability that you might have as well.
Sure.
Thank you.
Siobhan, have you got anyone that you might have offered My Diabetes to?
Not yet, but Natasha, our diabetes nurse, is really interested in it. So I'm sure she's going to be onboarding patients pretty soon.
Yeah. And I think once you get confidence that you've got your password and your login, it's relatively quick to add a patient. It does take seconds. And if you forget how to do it, then don't worry. If you've got a digital care coordinator or digital support, admin support, you could always ask them to do it in the meantime. But just remember that link is there. That link's on the Diabetes Arden template, so that will take you straight into it. If you forgot your password, that's okay. Just do the password reset. It will your username is your email. It'll send you an email and you can reset your password. If you get into any problems, they're in Bournemouth. There is a hotline number you can ring, or you can email the operations number and they'll sort you out if you've just struggling to get online. Use the support. Any other questions? Has anybody referred to Refocus Eyes over in the East? So Refocus Eyes is a pilot at the moment in the East. I'm not sure if there's plans at the moment to do it in the West, but these patients have all gone through the Heart Club and they've had a physical check to make sure they're safe to exercise by the Heart Club. And they're meeting in the Heart Club on Thursdays, I think it is, at Bournemouth Hospital. And they're having education along with their exercise. And then I'll be attending the sessions as well to give them some digital support and obviously seeing if they would like to take part in My Diabetes. So that might be coming as a replacement for Refocus. So my email, if people don't have it, is Cheryl O'Sullivan, just without the apostrophe, at dorsetgp.nhs.uk. Drop me an email if you'd want me to come to the surgery or set up a Teams meeting with your diabetes nurses or whoever might see your patients in general practice. I know pharmacists are often involved now as well. Carly is our project support. So Carly's here for any other sort of more sort of wider PCN project support as well. Okay, so the next huddle we have is a drop-in huddle, which is next Wednesday. I think it's the same time. Is that right, Louise? I think it's the same time next week. And Louise, myself and Siobhan should all be present for any support with the projects that we're running at the moment. So if you just
yes,
want to,
it is at the same time.
yeah. If you want to come along, bring your lunch and just ask a question and disappear again, that's absolutely fine. Bye, Agnes. Nice to see you. Then, please do so. You should all have an invite in your calendar. So come along as you'd like. Carly, anything else your end?
I've just put in the chat the R Dorset Digital email address. It's probably best to direct any queries that way, just because obviously the clinical team are mainly available on Wednesday, so we don't want anything to get missed.
Yeah.
So do pop any queries across to there and we'll make sure that they get to the right people.
There you go. And other than that, enjoy your Wednesday and enjoy your lunch. And I'm off to tell people about their blood pressure.
Thank you.
All right. Nice to see you all.
Bye.
Take care.
Thanks. Bye.
Bye now.
Bye.
Bye.
Thanks, bye.
Thank you. Bye.
Bye-bye.
Bye.
Bye, Siobhan.
See you later.
See you
Bye.
later. Bye, Leslie. Oh, Leslie, you're on mute. Top right-hand button that says microphone.